Welcome everyone. We're here today to learn about cholesterol, and with me I have one of our cardiologists, and I'm going to ask him to introduce himself.
Hi, my name's Amitoj Marwaha, and I'm a cardiologist at Valley Medical Center.
Great, thanks for being here. Let's start off with our first question. What is cholesterol and why is it important for our bodies?
So cholesterol, a lot of people think it's like a fat or something, but it's actually a subgroup of steroids. And it's important for our bodies for maintenance of like cell membranes, and it's also involved in some hormone formation and vitamin formation. So it's actually quite important for living, but as is typical, sometimes we have too much of a good thing.
What are the different types of cholesterol and other blood lipids?
So there's actually several different types, but I think to keep it simple, the most important, the two most important to know would be HDL or high density lipoprotein, which are the portion that takes cholesterol from the blood to the liver to be excreted from the body. So that's your good cholesterol, right? And then there's LDL or low density lipoprotein, which does the opposite. It takes it from the liver and distributes it out to the rest of the body.
How does cholesterol contribute to the risk of heart disease and other health conditions?
So good question. So like I mentioned, the cholesterol gets taken out with LDLs from the liver to the rest of the body, and it's essential for functions of the body such as cell membranes, hormones, and vitamins. But when you have an excess amount of cholesterol or LDL in this case, those get deposited into your blood vessels and they start forming plaques. And the best way to think about a plaque is it's almost like rust inside a pipe. So over time, it will slowly start to build up and sort of constrict the flow. And that's one version of heart disease or atherosclerosis. And then if sometimes those plaques, they become unstable and break loose and actually plug the artery, and that's what we essentially is a heart attack or a stroke.
So how can people reduce their cholesterol levels naturally through diet and lifestyle changes?
So good question. So for diet, you would think consuming cholesterol would be the key. But however, when you consume more cholesterol, your body just produces less of it. So that actually doesn't really affect your cholesterol a whole lot. What really affects it is fats. So particularly trans fats and saturated fats. Consuming those really improve or it really increases your serum levels of cholesterol. So if we're able to substitute those, so those are fats that are essentially solid at room temperature. So a lot of animal fat, lard, and everything like that. Red meat has a lot of that sort of thing. If we substitute that for unsaturated fat, which is vegetable oils, fish oils, things that are liquid at room temperature, that can reduce your cholesterol by substituting the bad for something a little bit better. Eating vegetable oils or those sorts of things don't necessarily by themselves reduce cholesterol, but having those in place of less healthy fats can create an improvement in your cholesterol. The other thing you can do is exercise. Any kind of exercise is good. Aerobic exercise, weightlifting, doesn't matter. Just get out, do something. Exercise can help lower your LDL, but more importantly, it can also help raise your HDL, so your good cholesterol. And there's very few things that can raise your good cholesterol, but one thing that does do it is more activity.
When would medication be needed to manage cholesterol levels, and what types are commonly prescribed?
So when do you start medication? So if you have evidence of plaque formation, so we can see that sometimes on CT scans or ultrasounds. A lot of times we find it incidentally. There are also scans you can get specifically look for, like heart scans and whatnot. Yeah, they can find it. So if we see that, that would be a reason to start lowering your cholesterol or getting worried about it. The other things that we can do, there are also quite a few risk calculators online. You can certainly find them. If you have trouble, ask one of your providers to run it for you. It just takes a couple minutes. It'll take your lab tests, your age, gender, and medical history, and then come up with a risk profile of how worried you should be about developing coronary disease, heart attack, stroke. And if you're in the high risk category, you should really think about starting medications to lower your cholesterol. If you're intermediate risk, I would certainly think about it. If you're low risk, that's less of a concern. However, people do have significant family histories. So any of those reasons to start lowering it would be good. And we already mentioned, natural ways to do it with diet and exercise. Starting medications. So if you have evidence of plaque formation and atherosclerosis, and or you're a high-risk patient, your goal LDL, so your goal bad cholesterol should be 100 or less. And if you have history of heart disease or stroke, it should actually be 70 or less. And there's some evidence it should be even lower, potentially even to 55, right? Getting it to 100 or less, you might be able to do with diet and exercise by itself. Getting it to 70 is really hard to do without some sort of, medication. And definitely 55 is going to be really difficult to do without medication. Not to say it can't be done, but it's pretty rare, right? So what medication to start? The standard that's been around for decades are statins. Statins get a lot of bad publicity or press because people are concerned about side effects. I would say the earlier generations of statins, which were around 40, 50 years ago, the first generation, they did have a lot of side effects to them. The newer generations, which have been out for about the past, let's say, 20 years, still have some side effects, but they're much less and relatively rare. So I would say that if you were to start something, I wouldn't be afraid of statins. I would say give it a try. The vast, vast majority are just fine and they work very effectively. If you do have a side effect, most of the time it's muscle pain, then we can try something different. That would be the standard medication. The other medications for cholesterol really haven't, they do affect your cholesterol a bit, but there's nothing nearly as good as a statin. The other thing to remember too is that statins help improve cholesterol, but they also improve mortality. So they have benefits beyond just their cholesterol lowering potential. Why that is no is quite sure, but they do help. So I would definitely start with that.
How often should adults have their cholesterol levels checked, and why is regular monitoring important?
So if you are healthy and don't have any medical issues or risk factors, then the recommendation is to check it every few years, 3 to 5 years. If you do have plaque buildup, a history of heart attack or stroke, or a high risk, I would check it yearly. If we are adjusting your medications for cholesterol, I usually check it about 3 to 4 months after any medication adjustment, and then once it's stable, we can do it yearly after that.
Are there some common myths or misconceptions about cholesterol?
Yeah, there are a couple, there's quite a few, but the couple more common ones would be, one, that it's a disease of sort of elderly people. While it is true that sort of middle-aged to older people have higher levels of cholesterol and plaque buildup, we actually see it in a lot of younger people now. So there is actually good evidence going back years that you start developing plaque buildup in your late teens to early 20s. We've seen more children and young adults having more plaque recently. So it's not unheard of to have major cholesterol issues and major plaque buildup as a young person. The youngest person I've seen have a heart attack is 27. So while it is unusual to have someone so young, it's not unheard of anymore. So that would be the number one myth, that you don't have to worry about it until you're like 60 or 70. you should worry about it as a younger person, right? An early adulthood, it's something to at least consider and be evaluated for. The other myth that I hear often is that I don't need to worry about it because I don't feel anything. It's not causing any symptoms. And unfortunately, these are sort of like silent diseases in the sense that a lot of times you don't feel anything until you have a heart attack or a stroke. That's usually the first sign that there's something wrong. So just because you don't feel something, if your numbers are off or if you see evidence of plaque buildup, it's something to take seriously and address.
What advancements in cholesterol management or treatment have been made in recent years?
So the major advancement has been the development of what are called PCSK9 inhibitors. So that's a medication that affects cholesterol production different than statins. They're injections, which some people don't like, but the advantage to them is that they don't have the side effects of statins and are very, very effective in lowering cholesterol. They were actually developed in conjunction with people taking them with statins, so you don't have to stop a statin to take them. We have gotten it started on a lot of people who just can't tolerate statins. So like we mentioned previously, if you take a statin and it just doesn't work for you, you're having side effects to it, this is actually a really good alternative now that we didn't have several years ago. The side effects are fairly minimal, and like I said, you don't get the muscle pain. Most commonly, you get injection site reaction. So when you get injected, it gets a little sore for a day or two. That's the most common reason or common effect that people have. The lowering effect is very impressive, up to 2/3 reduction in LDL. We do have it taken in people who also take statins. So it's not as if like you can get on this and you have to stop a statin. If your cholesterol is not at goal with a statin, we add this on. If you have a side effect to a statin, we switch it to this. So it's really great. The downsides to it, number one, cost, because it's new. We do a lot of work to get insurance approval. But even with that, sometimes it can be expensive. The other thing to consider is that while the numbers are improved quite dramatically, it doesn't have the long-term research behind it like statins do, right? It hasn't been out long enough. So will they have the same benefits that we've seen to statins? Like I mentioned, that the statin benefits go beyond just what we see with cholesterol lowering. Will these have the same benefits? I don't know. Maybe, maybe not. But it is a huge breakthrough and a major alternative to statins that we now have available that we didn't have several years ago.
So if a patient has labs done with their primary care provider and they learn that they have high cholesterol, at what point would they be referred to you as a cardiologist?
So usually we see patients with high cholesterol, number one, if they are not adequately treated with a statin or have side effects to statins. Statins are basically the sort of the mainstay in first-line treatment. So if you're able to take them and your levels get down, you don't necessarily need to see a cardiologist. But if you still can't get at goal, or if you are having side effects, then certainly we see a lot of patients like that. If you have evidence of plaque buildup, we get referral to a lot of patients with that, with all manner of cholesterol levels, normal, high, any of them. If there's evidence of plaque buildup that you can see on a scan that either is incidentally found or it's a scan that you specifically got, like there are a lot of companies that do like cardiac testing and stuff like that to evaluate, or anybody with a history of coronary disease, heart attack, stroke should definitely be seen by cardiology to help manage their cholesterol.
Thank you for answering our questions today, Dr. Marwaha. And for those of you watching, you can learn more by going to our website.